Hello, let's talk about the prevention of diabetes today. I am Dr. Nikhil Tandon. I am from the Department of Endocrinology at the All India Institute of Medical Sciences, New Delhi. Today, I will tell you how you can protect yourself from diabetes. Now, for understanding that, we must screen individuals to diagnose them early. We therefore need to ask a few questions. What is screening? Screening is a practice wherein people who are apparently healthy are tested to look for the presence of a disease. This permits early identification of the disease even before the patient begins to suffer from its clinical symptoms and complications. We consider screening if the following conditions are met. Why would we want to screen? Number one, is the disease an important health problem? Do we understand the early development and natural history of the disease? Is there a test we have which can predict the early or the pre-disease state? Are there safe, reliable, and effective ways to prevent the disease if we do find out about it? And how easy is it to find individuals at high risk, and what is the cost of intervening in them? Now, does diabetes actually fall in this category of diseases? Absolutely. Diabetes is one of the most prominent diseases along with hypertension or high blood pressure, which is an ideal candidate for screening. It is undoubtedly an important health problem. Even by conservative estimates, there are more than 100 million people with diabetes in India, 10 crores. While previously it was considered to be a disease of the urban affluent population, today, with improved developmental indices, even rural areas are showing an increasing burden of diabetes. There is increasing knowledge of the risk factors and the natural history of the disease. People who are prone to diabetes may initially just have a small elevation in their blood sugar after they've eaten a meal or when they're under some sort of physical or mental stress. Over a period of time, the blood sugars tend to rise such that they become high even in the fasting state. Unfortunately, the disease can remain asymptomatic for a long period of time, and people, unless they are screened, may remain undetected for years and may unfortunately present to medical attention for the first time only when they have developed a serious problem or a complication of diabetes. For example, a kidney problem, involvement of the retina, involvement of the nerves, or sometimes even a heart problem. Fortunately, we can use blood glucose measurements either using a fasting blood glucose value or a measurement of glucose after feeding people with oral glucose or doing a test called a hemoglobin A1C, which is a measure of the average glucose in the past 3 months. And this allows us to identify people who have either early diabetes or who fall in the category of pre-diabetes. Now, what is pre-diabetes? This is a condition where the blood glucose levels are higher than what we can say are normal, but lower than that required to make a diagnosis of diabetes. Identification of such individuals allows us to initiate strategies to prevent the disease from progressing to overt diabetes, and in some instances can even reverse it to a state of normalcy. Fortunately, balanced, healthy diet focusing on 3 or 4 important principles: the total amount of food eating, the type of food item consumed, ensuring that you have multiple meals without large portion sizes, and keeping suitable gaps, neither large nor small, between meals or snack times is advisable. Coupled with regular physical activity, it is very effective in preventing disease progression in a majority of individuals. This lifestyle modification must be pursued in a systematic and sustained fashion. There are different ways we can identify whether a person is at high risk for developing diabetes. One is called opportunistic screening. That is, when someone above a certain age, let's say 30 years or more, goes to see a doctor or to a health facility for any problem. The opportunity is also used to test for whether or not they have diabetes. Another approach, which is being offered by the government of India, is to screen anybody above the age of 30 years for diabetes, given the fact that it has such a high prevalence in India. You can screen at workplaces, you can offer annual health checkups in workplaces, and these are also additional ways for screening. If identified with diabetes, medicines can be initiated over and above the lifestyle measures I referred to, and then you must initiate a periodic monitoring strategy to evaluate if this intervention is keeping sugars under control or whether you need to do something more. If at that point, instead of diabetes, we diagnose a person to have pre-diabetes, we can initiate intensive lifestyle modification with dietary changes and regular physical activities. And here too, periodic monitoring is undertaken to ensure that the strategy is keeping blood glucose values under control. Now, how do we identify whether a person is at risk for developing diabetes? These are obviously, age is important. Older people are much more likely to develop diabetes. Those who are overweight are again important. Those who may not be overweight but may have a big waist circumference alone. Those in whom there is a family history of diabetes again are those who are at high risk, and therefore we must keep a special lookout for them. People with high blood pressure, people who are sedentary, that is, they have very low physical activity, are other individuals in whom we must be careful that they have a high risk for developing diabetes, as are those with high cholesterol values. What are the key components of a prevention program? The 5 goals of treatment in this are: number 1, we must, in an overweight individual, reduce the weight by more than 5%. Secondly, that the amount of fat they consume should at no circumstance exceed more than 30% of their total calories. And of that also, the saturated fat, just as ghee, makhan, these should be restricted to less than 10% of total calories. The other important factor which is relevant is we must increase the fiber in the diet. For every 1,000 calories that the individual eats, there must be more fiber, which could be both soluble and insoluble fiber. And finally, moderate exercise, at least 30 minutes per day, in a supervised fashion, progressively increased and tailored to our specific requirements, and also including some component of resistance exercises, is really an important part of this effort. Remember, a healthy lifestyle is our best defense in preventing development of diabetes. I hope this was of use to everybody who was listening in. Thank you and namaskar.